everyone, I'm Carly Biron here today with an episode of the EchoStor Healthcare Heartbeat. I'm here today with Mike Hale and Tanner Crowe, who are two members of EchoStor's dedicated healthcare practice. Mike is a principal solutions engineer with over 15 years in healthcare technology executive leadership, and Tanner is a solutions engineer with a decade of experience in healthcare IT architecture, administration, and support. Today, we'll be talking about virtual infrastructure, hypervisors, and virtual desktop infrastructure, VDI. Many of our healthcare customers use some form of VDI to deliver applications to their users, and virtualization as the basis for that at a hardware level. Mike, tell us about virtualization and what you're hearing from healthcare organizations you've been working with.
Yeah, thanks, Carly. As you mentioned, VDI solutions like Citrix are really widely used delivery mechanisms for Epic clients. What we've seen in this space is that the solutions need to be performant, and because they're key to the end user experience, they're really the front door that the providers use to provide care to patients. And there's a lot of factors and considerations that healthcare IT professionals need to take into account with this application delivery layer and the technology underlying. Most use Citrix, but some use Horizon and Omnissa. And you need to think about things like, again, your current performance and accounting for things like growth and resource requirements due to upgrades, which hopefully for a growing a number of users. Tanner, why don't you tell us about your experience working with VDI technology in an Epic environment?
Yes, for an Epic customer, your VDI environment might be your largest piece of infrastructure. It usually requires a significant amount of hosts, whether that be bare metal or virtualization. And if you're using virtualization, particularly around Broadcom and VMware, we really want to try to find that right spot between core count and maximizing that host per session. We do have other customers that are using other platforms for this, like instead of using VMware, some are leveraging AHV from Nutanix, and others are leveraging Citrix's native hypervisor for this. So a few things that people should consider when you're sizing or building these environments, like I said, is sessions per host. Your image management, how are you delivering these? Are they shadow copies of each other? Are they full-size copies, persistent desktops? And then another big piece is profile storage. Is your user profile storage fast enough, and can it deliver the I/O needed to keep up with shift changes, log-on storms, really any big event that was going to drive high performance in?
Yeah, there's a lot of our customers, obviously, with the changes at Broadcom with VMware licensing, are really rethinking the way they deliver and provide the underlying operating systems for infrastructure in Epic. Some of them are looking at potentially bare metal as an alternative to paying the price of virtualization, which does come with its benefits. You do get a lot of benefits, but it also adds a lot of complexity to an environment. So a lot of things to consider. There's things like spikes in peak time, as you mentioned earlier, and your failover needs. All this kind of needs to be taken into account when thinking about your hypervisor strategy or lack.
Yeah, and something to consider too is the metrics you keep track of when building and running one of these environments, like your login times. That's really important for a hospital is how much time does it take any one provider to log into a desktop and to get a session of Epic up and running? Because that is time that is valuable to the organization, and if you have slow login times, that takes away from time for providers with patients. So also think of your third-party integrations that you might have, whether that be something for a badge login or any other third-party applications that you are running in your VDI image that are related or, are Epic adjacent.
Yeah, and you and I have firsthand experience, right? With slowness is a terrible word in technology, especially in a healthcare space, because you end up with a bunch of angry doctors and even worse, a bunch of angry nurses.
Yeah, time lost and frustration really it puts your IT environment front and center to the provider. So we really want to do the best we can to minimize their interactions and frustrations with it.
Yeah, it's a lot to navigate, a lot to take into consideration. That's part of the challenges of being a healthcare IT professional. That's where an experienced partner like EchoStor can help and take all these factors into account, really develop solutions that deliver the best outcomes.
Exactly. Thank you so much for the insight, guys. This has been today's episode of the EchoStor Healthcare Heartbeat. Until next time.